Hi, I'm Cathie. I'm one of the arthritis educators in Wellington. You may or may not be aware that most of our educators are actually registered nurses. Laurie and I, the two educators in Wellington, have been asked by the Ministry of Health to help with their National Contact Tracing Centre at the Ministry of Health building. So I just thought you might be interested to know a little bit about what actually happens at the Tracing Centre. So the Tracing Centre is based in the Ministry of Health building in Molesworth Street in Wellington. It's a lovely new reinforced earthquake-proof building, yay. There's a large team of allied health professionals, so we're not all nurses, but people that have some kind of medical background. And there are 2 shifts a day, there's a morning shift and an afternoon shift. And what happens is that we are issued with what they call a batch of numbers to ring, batch of people to ring, and each person on our list has been identified as being a close contact with someone who is identified as being positive for COVID-19. Our role is to inform them that they have been identified as close contact. Some people are aware and some people aren't. And then to make sure that they're well or check on their symptoms, give advice about when to see the doctor. And if they are symptomatic, they'll need to go for testing. And then we talk to them about self-isolation and the type of self-isolation that's required when someone has been identified as a close contact. So that's another layer on top of what we are all doing in our form of self-isolation just now throughout the country. What's involved with that self-isolation is, increasing that physical distancing from those in their household bubble, making sure that they have separate sleeping space, bathroom space, or at the very least disinfecting it each time they use the bathroom, their own soap, toothpaste, toilet paper, utensils, plates, cups, and doing their own laundry. So just really taking that to another level of self-hygiene to protect those from their family bubble and their family bubble from spreading the virus around. And they have to be in that self-isolation for at least that 2-week period from the time that they've been identified as being exposed. So as you can imagine, it's a big job. It's not a exact science. This information's coming into the call centre from regional public health, from customs, from the police, and then anybody that we're not able to contact, they're then referred on to a finding service to provide further details, contact details, so we can contact those people. The whole idea is just to protect us all and break that chain of transmission. So it's a really important job that this team's doing, and you may or may not be fortunate or unfortunate enough to get a call from the tracing team. If you do, just be patient with us. We're all learning as we go. It's new for everybody, and some people have been, receiving multiple calls from multiple people. So we're trying to get it right. Bear with us, and it's all for the greater good. So I thought that might be of interest to some of you, and just checking in, really, trying to keep spirits lifted. Hope you're all doing okay. If you need to speak to an educator, there is someone on duty each day, and we are happy to talk to you and give you some support to help get through this time.